Well, hello. Welcome back to the channel. Good to see everybody. Appreciate you tuning in. I'm Dr. Marshall with Medical Specialty Clinic. Recently, I've had a lot of patients that are very concerned about their heart rhythm, but I'll have them, they'll come in and say, you know, Doc, I've got an Apple Watch or a Fitbit that checks their heart rate, and sometimes their rhythm. There is a difference. So the rate is just how fast the heart goes. The rhythm is what is generating the signal of how the heart is beating and what pattern. So normal heart rhythm is sinus rhythm, and the normal heart rate is 60 to 100. Below 60 we call bradycardia. Now if your heart rate is in the 50s and sometimes even in the 40s if you're on medication, that's not dangerous. Typically, if it gets down in the 30s, that's a little too slow and something probably needs to be looked at. If not, something done about that to keep the heart rate up. If the heart rate is over 100, we call that tachycardia, and there are many different kinds of tachycardia. Heart rate is going to go up normally when you exercise. So if you get on a treadmill or you're running from a dog or something like that, your heart rate's going to go way up. You get startled, it's going to go up. Heart rate can go up quite a bit, and it's still not hurt anything. As long as it goes back down within reason when you're resting. Typically, your maximum heart rate is 220 minus your age. So if you were 40 years old, your maximum heart rate would be about 180. So if it's getting over 180, then that would probably mean there is something wrong with the conduction system of the heart that's allowing it to go too fast. And the problem there would be the heart beats too fast, does not have time to fill up with blood to pump that out. And then if the heart's beating too slow, obviously that's just not enough flow to sustain oxygenation to the tissue. And typically what you see when the heart rate is either too fast or too slow is that if you try to do anything, you have no reserve, you're very weak. So if the heart rate's too slow and you go to stand up, you're going to be very woozy and weak. And if it's too fast, you'll notice that typically beating real fast, and then you'll also be weak just because the heart does not have time to fill up with blood to pump that out. It's just going too fast. Those are just a quick information about heart rate. So that's rate. A heart rate's very easy to check. You can just put your finger on your radial artery here on your wrist and feel that pulse. You could also check your neck. So just there's a little muscle there, the sternocleidomastoid. You come off the edge of that, right in that groove, that soft spot. Typically you can feel the carotid artery. So there you can check your pulse. Just check it for 10 seconds and then multiply that by 6. Or you can check it for 6 seconds and multiply that by 10. It might be a little bit easier. Or you could check it for a full minute and count the total number. And again, 60 to 100 would be in the normal range. If you're concerned about your heart rate at all, obviously discuss that with your healthcare provider. But the reason I wanted to do a video today is to talk about some devices that can help monitor your heart rhythm as well as your rate. And so people get very concerned about that, and I've seen several of them recently that had questions about it and they're wondering what they can do. They'll notice it with a device that they have, a watch typically or something like that they're using to monitor their heart rate, and they'll get an alert that their heart's out of rhythm or going too fast or too slow. And there are some devices that you may have heard of that you can use at home that are good for rhythm. So they'll actually tell you the rhythm. So is the heart generating an appropriate signal to beat from the normal spot in the heart? And the normal spot that starts the heartbeat is called the sinus node. And so a normal 70, 80 beats per minute heart rate in an otherwise healthy person is going to be sinus rhythm. And if you got it 80 beats per minute, nothing wrong with you, and it's coming from the sinus node in the heart, that's going to be a normal sinus rhythm. Now you can get a normal sinus tachycardia. That would be you're on a treadmill exercising, you try to get your target heart rate up, to 120, 140, something like that. That's going to be normal. It's still going to be generated from the sinus node, so that's going to be a sinus tachycardia, a normal sinus tachycardia. You can also have a sinus bradycardia that's normal, so a heart rate in the 40s or 50s. Some elite athletes, their heart rate at rest will be in the 40s, and that's completely normal. Nothing wrong with them. Now, if your heart rate is normally in the 60s or 70s and it's dropping down into the 40s, that's probably something wrong. Need to get that looked at. But again, if you have any questions about your heart rate, if you don't feel it's appropriate, go get checked out. You let your doctor see you. They can do lots of different kinds of testing to evaluate that. Heart monitors, EKGs, echocardiograms, things like that. Your primary care doctor can start that, and then if they need to, they can get you to a cardiologist for a more detailed evaluation. I won't go into all the different kinds of dangerous rhythms, but generally they're going to be a rhythm that comes from somewhere other than the sinus node, so you can get just a signal started from somewhere in the atria or multiple spots in the atria, and that can cause atrial fibrillation. There can be ventricular tachycardia, where the heart rate is being stimulated by the ventricles further down in the electrical system. And then that is a dangerous rhythm. And then ventricular fibrillation is very dangerous. And that usually requires a shock to the heart to shock it back into hopefully a sinus rhythm. But those are just a few different rhythms. There are many others that I don't have time to go through. And the purpose of this video is really not to go over different rhythms. It's to give you an introduction to a device that can help you check your heart rate and rhythm accurately at home for very little cost and very little effort. The one that I have here in my hand is the Kardia Mobile 6-lead. So that is going to do a 6-lead EKG. And then the basic Kardia Mobile is just a single lead EKG, but it will give you rate and rhythm. And then they have one that is a card, like a credit card. I'll show in just a second. This is a single lead EKG, but it is very handy. The Kardias look like this. So you put your fingers on them and they connect to your phone. Typically you've got a smartphone and they'll connect to your smartphone, and as soon as you put your fingers on the Kardia Mobile single lead, it will, if that app is open, it will start to read your EKG, and it does that for 30 seconds, and then it will give you a report at the end of the 30 seconds to tell you what rhythm and rate you're in. So I wanted to show you these. This is very neat. So this is the 6-lead. So it looks almost just like the single lead Kardia Mobile, but it has a contact on the back as well. So you would put that, you hold it up where it makes an A. That's the proper way. So you hold it in front of you where it makes an A, and then that you put that lead on your leg. So you can have a pair of shorts on or cross your legs and pull up your pants, and you can put that down and touch that to your leg at the same time, and it will take a reading. So that's the 6-lead. And just as far as pricing goes, the Kardia Mobile single lead, just the basic product, is $79.99. And then the Kardia Mobile card single lead is $99. And then the Kardia Mobile 6-lead that I just showed you is $129 right now. I think it was $149. All right, so this is the Kardia Mobile card. This is pretty neat. You can carry this in your wallet or your purse and have it with you. It's very easy. You just pull out your phone, open the app. Now this is after you've paired it. You have to pair it to the phone, which is very easy. I won't go through that process, but it's pretty easy. So they come in a carton like this. So this is the $99 product, and comes in this, and then here it is. You just pull that out. That is it. So that is the Kardia Mobile card. This will take an EKG, a single lead EKG on you. And you can see it is pretty thin. A little bit thicker maybe than a credit card, but not much. It's about the same. So it's got a power button on it right there. So you open your app, and I'll show what that looks like on my phone. And then you hit record your EKG. And at the top, if you have different devices, I've got two. I've got the Kardia Mobile 6-lead and I've got the Kardia Mobile card. So you select which one you want at the top. There's a little drop down. Select that, hit the power button, and you can see it's flashing if you can see that. Then you just hold your thumbs on it, and it will initialize, and then it will start taking an EKG, and it counts down for 30 seconds. So you just hold that gently. You don't have to press hard. Take some steady breaths. You don't have to do a deep breath. Just breathe normally and try to be still, and probably not best to be talking a lot while you're doing your EKG. 3 seconds, 2 seconds, 1 second. All right. And then it gives me a report of normal sinus rhythm. A little bit off, I was moving. But anyway, I'll do a little video up in the corner of what it looked like on the phone, what you see when you get it done. But these are pretty handy devices, very small, reasonably priced. The most expensive one now is $130. So if you are someone who is concerned about your heart rhythm and wants to watch that, or your heart rate, then you can get a closer look at it with one of these, and those results can be sent to a cardiologist or your primary care doctor. They can be, I believe they can be printed out, and then there's also a subscription you can sign up to that has extra features. Now you have to pay extra for that. I think there's a monthly fee. That is Kardia Care, I believe. Kardia also offers connection to a blood pressure cuff, so you can check your blood pressure and link it with your phone. I think it's an Omron product that will link up. And then I believe they also have an interesting, almost like a stethoscope, which listens to the heart, and it connects to your phone, and you can actually send that sound recording to your cardiologist if they're in the network. So it's a pretty neat little deal. Technology's coming along. But of course, that's not a real time. They're not going to be listening to it while you're doing it. So it's not going to give them real time information. So if there's an emergency, if you think you're having a heart attack or your heart is significantly out of rhythm, get checked immediately. Call 911, get an ambulance, or get to an emergency room and get looked at. Don't try to get one of these if you think it's an emergency. If you're just concerned about it, want to check it, want to keep an eye on things, feeling fine otherwise, then this would be appropriate. Or if you have AFib and want to check your heart rate a little more regularly, these are pretty easy. Like I said, you just open the app on your phone, select the device that you're wanting to use, put your fingers on there, 30 seconds, you've got a reading. It's pretty slick. So anyway, I hope this provided some useful information. You can go to their website and check out their products. I actually have some at the office. I have a couple in stock, but I don't really keep them. I don't sell many of them. I just like to have them in case somebody's interested. You just go to kardia.com. That's KARDIA.com. And I was not paid anything to say this or anything like that. I don't make any money unless I sell one of these devices. But Kardia has not given me any money to say good things about them. But I do like the ease of use of these products, the size of this card that you could put in your wallet or purse or pocket even, and just carry with you if you want to check things. So very easy to use and very lightweight, small and compact. So anyway, again, thanks for tuning in. I really appreciate it. If you have more questions, if you want to discuss it with one of our providers, call the office, make an appointment. We'd be glad to talk to you as always. And again, thank you, and I look forward to seeing you in the next video.